Hi, everyone. My name is Chris Sealey, and I am the co-founder and president of CoverUS. From working with HIV-positive homeless New Yorkers to running think tanks that studied healthcare spending at the highest levels, I've learned just how much economics affects health and just how much health affects economics. And thus at CoverUS, we believe that you shouldn't have to be wealthy to be healthy. And we think the key to solving this problem is putting the power of data in patients' hands. So what are we doing? We know that healthcare is inefficient. The inefficiencies CoverUS is targeting are the inability of patients to afford care, the struggle that the industry has to directly engage consumers at scale, and finally, the data privacy risks that you've no doubt heard about throughout this conference and will continue to. Every day, your health data is bought and sold, largely without your knowledge or your consent. Very clearly, as human beings, we can see that this is an invasion of privacy. But at CoverUS, we really think this is also bad business for the industry itself. And as a result, what we are doing is we are building an app that allows you to protect and profit from your health data and engagement. So what does this mean? It means that patients can download their EHR, augment it with the sort of real-world data that only they can provide, engage in direct conversation with the medical industry in ways that provide better innovation and get paid for it, and then finally have their data protected by a framework that we call Respect, which is a data privacy framework and technology that we think is quite pioneering. Our Moonshot is nothing short of helping make healthcare more affordable for everyone, everywhere. And I think, as I stand here today, I feel very lucky to say that I think we have the right team of entrepreneurs, technologists, marketing folks, and finally a really world-class advisory board that's going to help us make it happen. We're very early. We don't have a product in market yet, but initial signs are very positive. There's a blockchain and crypto element to our business, and we started by winning a very prominent blockchain hackathon. Our initial friends and family round is oversubscribed and has really just mostly strategic investors, not friends and family. And despite being pre-product, we've had a lot of mainstream press, I think, and it shows the importance of the idea. What's next? Well, 2019 is obviously an exciting year for everyone, but particularly for CoverUS. We are launching our product in market by the end of Q2 with access to a patient population of 1.5 million chronic disease sufferers. And we're also doing something that we think is really important to build trust. Our entire business is a business of building trust with consumers. And so in addition to handling their healthcare data more deftly, we're actually allowing them to invest in our company through a regulated crowdfunding offering that allows regular people to actually own equity in CoverUS for as little as $100. And we're really happy to announce that here today at Startup Health. And the URL for that is coverus.health/invest. And really, when I think about these things, I say the right mindset, a moonshot vision, we can achieve the impossible. Well, we have a real opportunity today. And it's an opportunity to take this unbelievable stat that 37% of Americans can't afford a medical bill of $100, yet their data is being brokered by third parties to the tune of billions. With the people in this room today, I truly believe we have an opportunity to change this dynamic, but to do it, it has to happen now. So I'd really like to thank Startup Health, I'd like to thank JP Morgan, and I'd like to invite all of you to join us in our moonshot of making healthcare more affordable for everyone, everywhere. Thank you.